Hi everyone, you are welcome to this video. I'm so grateful for those who follow our videos, and in this video I'm going to answer one of the questions that people always complain, and they say, doctor, I'm always having blood in my eyes, blood staining in our eyes. Most times these patients always complain when they are referring to what we call subconjunctival hemorrhage, when there is bleeding under the conjunctiva. You know, a conjunctiva is a transparent layer on the eye. So under the tissues under the conjunctiva, when they get to bleed, or the small blood vessels bleed, they start spilling their blood, and we call it conjunctival hemorrhage, subconjunctival hemorrhage. So many people get to worry, and most times it happens in the people who have undergone an operation. When someone has undergone operation, most times they always have those subconjunctival hemorrhage. When someone is having constipation, someone can also have subconjunctival hemorrhage, and also a chronic cough. Someone also has a chronic cough, also causes, because the pressure is transmitted upwards and causes the small capillaries or the small blood vessels under the conjunctiva to bleed, and this blood makes the eyes to become red. And also most times this bleeding also happens when a person has allergic conjunctivitis. People keep on itching the eyes so many times, and they cause these blood vessels to keep bleeding under the skin. So it is very important to know this, and to avoid itching in cases of allergies. When the itching is much better, do what you call cold compress, where you wash your face with clean, relatively cold water, so that it can take off the irritations. And also there are many cases, for example, when a person has been using contact lenses, also they can initiate. When a person has got trauma, for example, when a person has been slapped, also can cause those blood vessels to bleed under the skin, under the conjunctiva. And also when a person giving birth, when the mother has given birth, when the mothers have given birth by normal delivery, because the pushing of children, people exercise, or mothers exercise a lot of force to push out the baby. It also transmits pressure back to the eye, and the small blood vessels also can go in and start bleeding. Then besides that, also in sickle cell anemia, you can also change of, you can see that conjunctiva also change. And also in cases of a bleeding disorder, what we call hemophilia, we also have these people bleed under the skin. One of the first things we do when you see that bleeding under the skin, the first thing is not to worry, and you visit the eye doctor. After visiting the doctor, most subconjunctival hemorrhages, they always resolve on their own. They can be reabsorbed back to the tissues in the eye. So this blood can clear off with time. Most times they always clear at around 21 days and above, and that is the best management. You need to be calm and wait for the subconjunctival hemorrhage to clear. Then also, depending with the cause, it is very important to consult from an eye health worker, who can also guide on the management of the underlying cause. For example, if it is trauma, to find out if other structures have also undergone through the same. So I intended to inform you about subconjunctival hemorrhage. You should not worry about it. Many people come when they are worried and with very many questions, asking if they will ever see again, whether and it will affect the eyes also go off. But it will just depends with what has caused it, and also the management option also depends on what has caused it. But most times the subconjunctival hemorrhages clear on their own. So that's what I intended to tell you today, and I want to wish you a nice time and see you in the next video.